The American Academy of Pediatrics recently changed its recommendations for screening heart conditions in children and young adults. They released these new standards Monday, hoping to spot heart defects before tragedy strikes. Western Mass News reporter Paris Dunford has more on a rare heart condition that can often go undetected.
It's an absolute nightmare to live every day. It never gets easy.
It's been nearly 10 years since Westfield resident Susan Cannon experienced one of the worst days of her life.
It was July 11th in 2011. It was an absolutely beautiful New England July day. He was swimming with friends at Congamon Lake.
Her son Kevin went underwater to anchor the boat and never came back up.
He had an undiagnosed hypertrophic cardiomyopathy.
Kevin Major was a 19-year-old athlete. He died from sudden cardiac arrest caused by a heart condition.
Now Cannon makes it her mission to hopefully prevent this heartbreak from happening to another family.
Cannon started Kev's Foundation, an organization that brings awareness to sudden cardiac arrest and severe heart conditions in children and young adults. For the last decade, she's pushed for more children to be screened for heart conditions. Those screenings, something Chief of Pediatrics at Bay State Health, Dr. John O'Reilly, says are very important.
Pediatricians should be screening their patients, pediatric patients, for cardiac disease throughout the lifespan, whether they're athletes or not.
On Monday, the American Academy of Pediatrics released new guidance for doctors. Previously, only athletes were screened for these heart conditions, but now the Academy suggests that every child and young adult is tested.
For most kids, this condition only shows up when their heart is acting at a certain level. So this enlarged heart muscle really only shows symptoms, when they really start to exercise.
And for some like Kevin Major, that moment can come unexpectedly. Dr. O'Reilly says if your child has a hard time catching their breath after playing outside or being surprised, you may want to consult your pediatrician. He also says it's crucial to update your doctor of any family history changes so they can keep an eye out for any warning signs. Reporting in Westfield, Paris Dunford for Western Mass News.